physical therapy is really an essential element of treatment for pretty much everybody that comes to see me in the office. In a lot of cases, musculoskeletal and orthopedic conditions can be managed with rehab is really the mainstay of non-surgical treatment. Everything from kind of muscle strains to rotator cuff tendonitis or overuse or repetitive stress injuries. We also see people with, for example, mild and moderate knee arthritis really benefit from physical therapy, that alone, increasing kind of muscle activity, strength, tone, core conditioning, et cetera, optimizing mechanics, can actually really make the symptoms of arthritis much better. There's also, of course, a major role for physical therapy following surgery and sometimes in advance of surgery. For example, with our athletes with anterior cruciate ligament tears, most commonly we actually do prehabilitation, in other words, physical therapy before surgery to restore knee motion and quadriceps strength, because that helps optimize the post-operative recovery and eventual outcome afterwards. But very commonly, any of the knee, shoulder, elbow surgeries that we do need a good physical therapist, a good course of therapy afterwards. And one of the things that's really important for patients going through therapy is that you kind of treat that as an opportunity to learn and kind of learn what you should be doing at home on your own as kind of a maintenance program. In non-surgical cases, you can often learn how to manage a condition by learning a good set of exercises and making that part of your gym or workout routine, or doing that as a preventative measure. And after surgery, for example, you're recovering from an ACL surgery or a rotator cuff repair or a Tommy John procedure in the elbow. You're making sure that you're doing your prescribed exercises between your therapy sessions in order to optimize your outcome.